on my one pager, MAR, and the provider order. Hello, my name is Jenna. I'm your nursing student today. Can you please verify your name, date of birth?
Madison Schneider, 5/14/05.
I'm just gonna look at your wristband, clean my hands, and provide privacy. Do you have any allergies I should be aware about?
Sulfa and betadine.
Okay. I don't feel the need to wear PPE or gloves today. Today I'm just going to be giving you your medication for the day. First I'm just going to ask you a few questions and then I will go get the medication for you, okay?
Okay.
Are you able to take medication orally?
Yes.
Okay. Are you on, do you have any pain today?
Yeah, but it's probably only like 4.
Okay. Well, I am going to go get your medication if you're in a comfortable position, and I will be back.
Okay.
Okay. So now I'm just going to gather everything I need. I'm going to compare the MAR and the provider order. I'm holding digoxin today because it's elevated. I'm holding Lasix because digoxin is elevated. And I'm holding warfarin because the INR is at the toxic level. So her pain is at Joe's pain today is at a 4. So I'm going to be giving Joe, 1 tablet of oxycodone and acetaminophen. And Joe gets that PRN if she's having any pain. I'm going to say 4 nursing considerations about oxycodone and acetaminophen. Assess for pain, the intensity, location, type, and the need for the pain medication. Monitor the I&O ratio. Check for decreasing output, may indicate urinary retention. Check for CNS changes, for dizziness, drowsiness, hallucinations, and assess for allergic reactions such as a rash or urticaria. And the uses of oxycodone and acetaminophen is it inhibits ascending pain pathways in the CNS, increases pain threshold, and alters pain perception. A lab value today is digoxin. I'm holding because it is 2.1, so it is elevated, and the toxic level of digoxin is 2.4. I am holding Lasix because digoxin is elevated, and I'm holding warfarin because the INR is elevated at 3.6. Okay. So after I compared the provider order and the MAR, I'm going to put the provider order away. And I am going to do my first medication check. Okay. Alright, so here I have oxycodone 5 milligrams and acetaminophen 325 milligrams. It is a Percocet for Joe Smith. 1 tablet PO every 4 hours PRN for a pain rating of 1 to 4. It has not been given yet today, and Joe rated his pain a 4, so we will be giving him 1 tablet today. Alright, and now I'm going to do my second check. I have oxycodone for and oxycodone 5 milligrams, and acetaminophen 325 milligrams. Percocet for Joe Smith, 1 tablet PO every 4 hours, PRN for pain rating 1 through 4. On the first check, I forgot to look at the integrity of the package. The integrity is good, and I did not say the expiration date. It is 03 of 2039, and then since I'm on the second medication check now, I'm going to say that again. The integrity is good, and the expiration date is 03 of 2039, and it doesn't need to be split or crushed. I'm going to give one whole. So that was my second medication check. Now I am going to go into Joe's room. Alright, knock knock. Hello, my name is Jenna. I'm a nursing student today. Can you please verify your name and date of birth?
Madison Schneider, 5/14/05.
Okay. Just going to look at your wristband and hygiene and pull the curtain. I don't feel the need to wear PPE or gloves today. Do you have any allergies I should be aware about?
Sulfur and betadine.
Okay. So I have your medication for the day, so I'm just going to tell you a little bit about it, ask you a few more questions, and then we'll get your medication into for the day, okay? And you told me earlier, but I want to verify again, you're able to take oral medication, correct?
Yep.
Okay. Are you in a comfortable position?
Yes.
Okay. And you said your pain rating was a 4. Is it still 4?
Yep, it's still
Okay.
a 4.
So I'm just going to scan your wristband here. And I'm going to do the third check. So here I have oxycodone 5 milligrams and acetaminophen 325 milligrams. It is a Percocet for Joe Smith, 1 tablet PO every 4 hours, PRN for a pain rating 1 to 4, and you said your pain was a 4.
Yep.
So the expiration date is 03 of 2039. The package is good, and I don't need to split or crush. Now I'm just going to scan the medication. I have oxycodone and acetaminophen, 5 milligrams of oxycodone and 325 milligrams of acetaminophen. Let's scan that. That is for pain rating 1 through 4. So I'm just going to tell you a little bit about the medication that I'm giving today.
Okay.
So oxycodone and acetaminophen is for pain. So I would give you 1 tablet for a pain rating of 1 through 4 and 2 tablets for a pain rating 5 through 10. Some side effects that are common and we see a lot are drowsiness, dizziness, and confusion. An adverse side effect is respiratory depression. Can you tell me what acetaminophen and oxycodone is used for?
Pain.
Okay. And can you give me 1 side effect?
Dizziness.
Okay, good. Alright, so if you don't have any questions or concerns, I'm going to give you the medication, okay?
Okay.
Thank you. Just some more.
Thank you.
Did it go down okay?
Yes.
Okay. So, if there were any adverse reactions, I would withhold any further doses. I would contact the pharmacist and the prescriber. I would document per agency findings, and I would, per agency policy, and I would take or assess your vital signs, okay?
Okay.
I will be back in 30 minutes to assess you.
Okay.
I'm just going to document my findings or that I gave you the medication.
Okay.
Just give me a minute. So the medications I held today is digoxin because the level was elevated. I held your Lasix because your digoxin level was elevated, and I held warfarin because the INR was at a toxic level. Okay.
Okay.
So I would document my findings per agency policy. Told you what I held. I told you when I'd be back to reassess. I told you what I would do if there were adverse side effects. I documented, and I'm going to document per agency policy. Do you have any concerns before I go?
Nope.
Do you need anything while I'm still here?
Nope, I'm good.
Okay. Alright. Gonna take a minute and think. Okay. So I'm just gonna make sure you're safe. Your bed is low and locked. Your side rails are up. Here's your call light.
Thank you.
Your side table is within reach, and your room is risk-free of falls. I would provide hand hygiene. The 5 stages of hand hygiene is before a patient, after a patient, touching bodily fluids if you touch patient belongings, and before or after a procedure. Just gonna take a minute to think. I'm gonna clean and cleanse all my stuff that I used. If you don't have any questions, I'm gonna go.
Okay.
Have a good day. Thank you.
Thank you.
I'm just gonna think for a second and make sure I got everything.